16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Hi, good evening viewers. Welcome to today's episode of KIMSHealth Doctor Live. Myself, Kripa Rajiv. Health is wealth. We are taking tiny steps to build a better health. So, in this episode, we have taken the topic general surgery for discussion. To talk more about this topic, we are having an efficient doctor with us. He is having 13 years of experience in general surgery and he is working at KIMSHealth Medical Center, Mohoreg. It's my pleasure to welcome Dr. Kiran to the show. Hi doctor, welcome to the show.
Hello, how are you doing?
Yeah, I'm good doctor, how are you?
Thank you so much for having me today.
Okay. Can we move ahead with the discussion?
Please.
Yeah.
I am Dr. Kiran. How are you everybody? I have about 13 years of experience as a general surgeon. I work at KIMSHealth Medical Center at Mohoreg. Today I am here to break down general surgery to all our viewers and allow people to understand what we do.
So, first of all, let me just ask you, can you please introduce what is general surgery to our viewers?
Definitely. General surgery is a branch of medicine that requires the use of surgeries or operations to treat medical conditions. It is an evolving branch of medicine. It has evolved from the olden painful large incision or cuts operations to the present day painless minimal invasive techniques that allow patients to get back to their life very fast. These surgeries have changed not only by technique and procedures, but also by the introduction of technology that make them easier, faster and better.
So, what do you mean by minimal invasive procedure?
A lot of terms are used to describe minimal invasive surgeries. Laparoscopy is one of them, keyhole surgery is one of them, minimal invasive surgery is one of them. It basically means that we are using small cuts less than 1 centimeter at various parts of your body, the abdomen mainly, to do surgeries that are not very large, and this allows the patient to experience a painless surgery and get back to their work as soon as possible. For the surgeon, it allows better visualization, it allows easier access, and also makes the post-op recovery very easy for the surgeon too. Less medicines are required, less time in the operation room, and definitely less use of anesthesia.
Okay. Coming to the anesthesia, doctor, when we are doing the normal surgery, we are very scared about the anesthesia because someone will be telling that we have to do it in the spine, someone will be telling that it's a general anesthesia. So, for this minimal invasive procedure, what kind of anesthesia is usually done?
Definitely. I would also like to use a word anesthesia as pain relief mainly. During surgery, especially when we say minimal invasive surgery or keyhole surgery, the anesthesia is always general. The spinal anesthesia is not preferred here. General anesthesia has also evolved in time. It has also become extremely safe. There is no concern about fearing that form of anesthesia, and since our surgeries have decreased time, we can use more superficial types of anesthesia that allow the patient to absolutely be pain free even during and after surgery, and not have the concern about using a lot of anesthesia or fear that it might cause a damage or harm to their body. Well, in such kind of surgeries, mostly spinal anesthesia is not preferred. Spinal anesthesia is reserved for the pelvic surgeries, or in my area surgeries for piles and related conditions.
What are the conditions that can be treated with this minimal invasive procedure?
Well, I would like to say the commonest conditions that I have come across in the Kingdom of Bahrain have been gallbladder stones, appendicitis, piles and related conditions, breast conditions, thyroid conditions, plenty of hernias. These have been one of the commonest conditions that I have come across in various forms and patients.
Can you please elaborate the thyroid condition?
Well, thyroid is a gland that all of us have in our neck, and the problems there usually are either structural or they are functional. By functional, I mean that they are related to hormonal changes. There can be an increase or decrease in the level of the thyroid hormones. The structural changes can present as neck swellings, and they frequently go neglected in the community.
Why do you say it is neglected in the community?
By neglected, I mean that many people probably do not recognize that they are present in their body. Such problems especially are very common in women, and because of the cultural dressing, because of busy schedule of their own, because women are very busy, I can understand, even homemakers are busy, even career women are busy. So, they tend to neglect or probably never realize that they are having a swelling growing in their neck. Now, whenever we do or address thyroid issues, we have several times noticed, especially the ones we operate, that they turn out to be cancerous in origin. I am not saying that all thyroid problems are such cancerous problems, but they definitely anybody who notices a thyroid swelling or a neck swelling needs to visit us and then get proper evaluation done.
Okay. Coming when you are telling about the thyroid surgery, I have a small doubt, doctor. Once the thyroid surgery is done, is there any chance for it to come back again?
Again, thyroid surgeries are of several types. In some of them we remove only half of the gland, in some of them the entire gland is removed. If you retain a portion of the thyroid gland, the intention is to continue to have your hormonal supplementation as before naturally. If the surgery or the condition requires the thyroid gland to be removed completely, then you are placed on hormonal supplementation. So, you take a very small tablet every day to continue your hormonal replacement as before. But if your thyroid gland has been removed in its entirety, you are not likely to have any problem in your thyroid gland ever again.
Doctor, can you please tell us about hernia as well as appendicitis?
Oh yes, appendicitis is one of the commonest abdominal pain conditions that we see. It begins as a sharp pain in the lower part of your abdomen on the right side mainly, and can be very incapacitating. Patients are alarmed, and when they come, we find that there is an appendix, which is a small tail like organ growing at the end of your colon, and that is inflamed and ready to burst open. It requires emergent surgery, and laparoscopy, the minimal invasive surgery, allows us to do it with very ease. Surprisingly though, these patients can get the surgery done in a day and be back on the track without feeling any reaction of the surgery or any adverse problem or side effect of the surgery at all. It is imperative that such problems are identified early to allow ease in surgery and faster recovery.
Can you please tell about hernia, doctor?
Oh yeah, hernias are swelling again in the groins and several parts of the body. They are usually protrusions and swellings that appear because of weakness of the abdominal muscles. Such swellings can also remain unnoticed for a very long time, but then if they get trapped, then usually it turns out to be an emergency. Again, in the previous days, repairing hernias required big incisions, a lot of suturing and pain, and the patients could not get back to their work at all. They were not advised to lift weights for more than 6 months of the duration after surgery. But now, with minimal invasive or laparoscopic techniques, patients can practically go home the same day and start even visiting the gym in a week's time.
Regarding the hernia, doctor, we have seen so many umbilical hernia in the babies. What do you advise to them?
Umbilical hernia is very commonly seen in newborns and children. It is advisable that nothing be done at least till 2 to 3 years of age. Some of them disappear spontaneously, no surgery is required. But then if the hernia persists after 3 years of age, then you need to visit a doctor, and again there are several ways and means to repair the hernia. But in children, less invasive and less elaborate techniques are used as compared to adults.
Okay. What type of treatment do you offer for piles and other conditions like piles?
Thank you for asking me this question. I have always seen that piles and related conditions like fistula and fissure are very less spoken about in the community. Patients shy away from revealing their conditions that have been identified surprisingly in the toilet by a blood in stools, by painful stools, or by swellings around the anus. Piles is one condition commonly called hemorrhoids in medical language and bouasir in the local language. Fistula is called nasur in Arabic, and it represents a small opening which pus discharge around the anus. Even sometimes it is very painful. And fissure is called shark in Arabic, and it represents painful passage of stools. There is a very big overlap amongst these conditions, and many a times, I think probably 99% of the times, patient visit us late. The most important concern they have is shyness, and they are not aware of what is happening. We urge patients and people to come see us with that problem, so that we can address them easily. Surprisingly, some patients do not need surgery, they can just take medicines and they will be all right. But if it goes ahead to become a little bit advanced, then we offer laser treatments as per the patient's requirement and eligibility. Of course, some of them go beyond our hand and control, and we might have to offer them a little bigger than before, but still we are able to treat them in the best way possible. Here your question of spinal anesthesia does come into play, and this is where we use spinal anesthesia very commonly.
Okay, can you please elaborate a breast condition?
Oh yes, again, since most of our discussion has been towards problems that people do not speak about, breast also remains same. Breast conditions are notorious, especially women worry about them in terms of breast cancer. We encourage self breast examination. We teach the techniques of self breast examination to women and encourage them to teach them to their sisters and daughters, because it is very important that every woman knows how to identify painless lumps in their breast at a very early stage. Since the problems are painless to begin with, we always want them to identify them fast, and breast cancer like thyroid cancer or any other problem, if it is treated identified early, it is treated early, and the success results are amazing. It is practically the most curable cancer available today. Apart from that, there are several conditions in the breast which are silent, which are painful, irritating, and they appear during menses, and women shy away from talking to us. We have very good female doctors, we have excellent nurses, and we address the modesty of the patient well, take them into confidence, examine and find their problems, use the appropriate investigations like a mammogram and an ultrasound, and provide them the right information and guidance and counseling to be aware of simple problems and future major troublesome problems if they are at risk at all.
Doctor, can you please elaborate the self breast examination?
Definitely. Self breast examination is a technique where women with the palm of their hand examine their breasts on either side in 4 quadrants of the breast when they are taking their shower or bath. This is a technique where women can identify changes in the nature or size or shape of their breast themselves, since they take care of themselves every day. This is a technique which is to be done in their privacy, and if they notice any abnormality in the breast, then they have to visit a doctor. I would urge that they even teach this technique to their daughters and sisters whosoever are at risk at breast cancers. Breast cancers are genetic in nature. Because of this problem, we identify families where there have been histories of breast cancer to depend a lot on self breast examination, and so that they can identify any lump which is painless. I repeat, the lumps are in breast cancer are painless, and immediately see the doctor, so that the doctors can take their finding, identify, investigate and provide them the right answer as to what is happening. Madam, in our discussion today, I would like to say that we are not here talking about surgery in itself. We are only looking forward to identify the problems, investigate them and provide the right information to the patients as to what is happening with their bodies, and if there is a requirement of surgery, we will be offering painless and minimal invasive techniques that not only decrease the fear of surgery, but allow a painless experience and faster recovery, so that patients can get back to their work fast.
So, we have covered almost all the queries related to this topic. Can you please give a takeaway message to our viewers?
Definitely. Hello everybody. Today I am not here, as I said, to talk about surgery or its problems. There are several issues in our body that we always shy away from discussing with ourselves, our family, and definitely a doctor. Please take the time to identify problems that you might have seen, noticed or fear since a long time, but do not take the time or do not have the energy to see a doctor for. Not every problem is major, not every problem remains small. It is up to the doctor to see your problem, discuss in privacy and investigate to tell you what is happening wrong with you. As a surgeon, if there is a requirement for surgery at all, you will be informed, and we will offer you one of the most advanced and painless and fast recovering techniques available to us. These techniques allow you to undergo the procedure without fear, get back to your duties, your work faster, and also not spend a bundle and worry about everything at all. The entire process is meant to give you good health, a safe health, not to create any confusion or send misinformation about your health conditions. Please do visit us for any surgical related question, and we will be happy to help you at any time at all.
So, for all surgical needs, you can contact Dr. Kiran. He will be available at KIMSHealth Medical Center. Doctor, can you please tell them about your timings also, so that it will be helpful for them?
Sure. We are available at KIMSHealth Medical Center at Moharak on all days other than a Friday, from morning 9 o'clock to 1 o'clock and evening from 5 o'clock to 9 o'clock.
Thank you, Doctor. Thank you for joining with us and answering all our query. I definitely hope that this episode will find our viewers very informative and useful. Next week, same day, same time, I'll be coming with yet another doctor. Till then, it's Kripa Rajiv signing off from KIMSHealth Doctor Live. Take care and bye-bye.